Shoulder impingement is quite common, and we know that there is a point where they feel like it's really uncomfortable, and then all of a sudden they reach a point where they think, oh, that's pretty easy, it doesn't feel like it's pinching anymore, and it's just when there's that gentle slip of that bursa where it's out of the way and they can actually get that arm to a better position. But when we're training them, what will we do and what do we avoid? And what is uncomfortable? You've learned everything about the scapula, how it glides, finding serratus anterior. Something that I must stress is when your client is incredibly neural and they've got neural referral, to then take their arms and reach that arm away out of its socket, pulls that area even more, and it can make it feel worse. So that's when you have to understand your client, their needs, what their symptoms are. And when they've got that neural symptom and you're pulling the neural areas, that feels more uncomfortable, and it can have the opposite effect of what you're trying to do, which means you're always going to be working bent elbows. You're going to get to the point where you're able to reach out, but it's not going to be immediate. Closed chain type of work will be a lot better for them in that state. But I've got Carlia, and I wanted to do a couple of demonstrations for you just to give you a little bit of guidance, things that you can do and things to avoid. Right. Whenever we're dealing with any kind of shoulder issues or impingement or irritation when they're raising their arm, it's always good to give them a support. Because when they have the support, they don't have the anxiety of lifting the arm and it's going to be sore. Yes. So I've actually got this box and I've angled it for Carly. So I want you to have your knee angled with the box. There we go. And I've got her elbow resting on the box. And that position is actually pretty nice. I'm going to check that she's not collapsing this side, which she was, and that's just because the box is quite low. But I'm going to pull her arm back. There we go. And I've got it a couple of inches away from her waist. And this is just to get it to rest, but to also feel that it has support. Keeping the length in the side of her waist, I want her to press this elbow down into the box, keeping the length in the waist. And that's going to get her to activate shoulder blade or scapular depressors, which is pec minor and lower trapezius. And the more I get her to press, it's going to start kicking into latissimus dorsi because I'm pulling that humerus down, and then gently release it. And exhale, pressing it down, good. And what I'm watching for is that this elbow doesn't shift back and come in all of a sudden. It stays at that angle, and then gently release it. And exhale, pressing it into the box. So it's a little bit of closed chain anchoring that we're getting in the shoulder, and gently release it. And last one, pressing it down, hold, good. And gently release it. From there, I'm going to ask you to press the elbow down again. If you feel that they don't have contact, you can give them a little pad, or I'm going to take a TheraBand and I'm going to roll it into a sausage. That's going to give her like 1 inch maybe under her elbow. And now she's got better like contact with the box. So from there, I'm going to ask you to press her elbow into the box and to just hover her hand off the box. Turn her palm in, just inwards. There we go. She's going to keep that contact with her elbow on the box. She's going to rotate inwards a little bit and rotate out to where she can, because this is normally the movement that feels really uncomfortable. And rotating in, but pushing her elbow into that band and gently rotating it out, getting that closed chain structured support, and rotating it inwards and gently rotating it back out. Good. And then placing the hand back down. Then we take the elbow and we move it more forward. So even if she has to lean the body forward to get it to that position, that's absolutely fine. Remember, the more forward I move the arm, the more flexion I'm getting in my shoulder. So I just want her to have that position. You'll see she's leaning a little bit over, pressing the elbow down again, lifting the arm up, hold, and release it. So not underneath. Okay, lift it up again. There.
There you go.
Right. Right, so lifting the arm up, the hand up, and we press the elbow into that and release it. So we're teaching the shoulder to just create space inside of it and pressing it. Hold that for me. Gently rotating the hand inwards and gently bringing it out. Hold. And gently controlling it inwards and taking it out and hold. And bringing it back and just relax it down. Turn your palm to face down. Right, so I've still got this underneath. I'm going to pull this back for her a little bit. There we go. Right. Now I want her to press elbow, wrist, and hand into the box. Just to give that support. And I'm looking at the scapula and I want that scapula to be flat and open on the rib cage. So you'll also look at everything that you've learned, which is thoracic spine is lifted, head position is up and back, shoulder is rolling back and down, and they're not doing this pec minor movement over there. Yes. So she's up and down, pressing elbow in, pressing hand in, and release. And pressing hand and elbow in, hold, and release. And pressing hand and elbow, hold, and release. One more. And pressing hand and elbow, hold, and release. Now I'm going to ask her to have her arms straight over there for me. So there she's got that position, don't need that anymore, and she's resting her hand on the box. She doesn't have to hold it up in midair. So you can have a look at what their range is where they're struggling. If you see that this is difficult, you're going to rotate them so that it is more in front of them. So the hand stays there, they just rotate the torso like that, so that the hand comes a little bit more horizontally adducted than abducted, all right? So I've got her over there, straight elbow, we're gonna inhale, exhale, we keep a straight elbow, we press the shoulder down, straight elbow, extend, thoracic extension, and release. And exhale, we press it down, thoracic extension, and release. Same thing where we turn the palm up and you'll know whether they feel comfortable in this position. Exactly the same thing, pressing it down, nice flat scapula, and release. That was a bit too much pec. And exhale, pressing it down, opening the shoulders, straight arm, and release, taking the hand off. Right, so now we're going to move the box out of the way. I'm then going to do some open chain stuff. So I'm going to have her facing this way, please. So let's say it's the left arm. You're going to place your hand inside there, your hand. There we go. So she's holding that. I want you to completely relax this arm. So that strap is actually holding her. And I want a dead straight elbow over there. She's sitting up tall, keeping that straight elbow. Just dropping this shoulder for me. Just a little bit, so she gets that hold over there, fully extended elbow. She's going to keep that position, and I'm going to ask her to hover her hand off of this. One, and then place it back down. And keep that shoulder held, and placing it down. And bringing it up, hold, and placing it down. And last one, bring it up, hold, and place it down. So she's holding on there. Now I'll ask her to rotate her body towards me, everything, and your knees. So I change the angle, not too much, because we know that when they get to that certain point, it's uncomfortable. So I can control this position because I'm pulling this forward. So you can have it in a band. Exactly the same thing. We're thinking that shoulder down, and it's a heavy blade. Keeping that, we hover it off. One, and relax it down. And lifting it up, two, and slowly down. And last one, lifting it up, three, and gently lowering it down. Rotate back to face there. Right, I want you up on your knees for me, please. Elbows in there. So this is all dependent on your client's ability to get to this point, because we know that there is a point where it feels uncomfortable and then it feels more comfortable. I want to get them to learn to get the shoulders down with a relaxed feeling, but in order to do that, I'm going to have to teach them that the shoulders can really depress and the elbows can work. And this is really more of a lat exercise, but we have elbows reaching that trapeze away, meaning serratus. I need thoracic extension, so she's going to open that chest out a little bit more. Excellent. Good. We're going to keep that. Inhale. A gentle press down on that trapeze. It's not intense. 1, and release it. And exhale, press down. 2, and release it. And exhale down. 3, and release. And last one down. 4, hold it, and gently release it. Sit facing forwards for me, please. Right, what it really does not like is when you lift the arm up, especially in that 30-degree scapular line, bend the elbow and do that. She even had a click. So this is a movement that's contraindicated for them, especially in the beginning. So it's really nice to do training exercises with them down here. And you've learned things where I say, press back into my hand here and release. Press up against my hand, just a little bit, not too much, and release. Pressing slightly forward. Closed chain, but in its innermost range, or its outer range compared to that. Just keeping it relaxed down to the sides. Even doing medial where she presses up against me there. Doing lateral where she presses up against. It's the lateral part that you've got to be careful of, because that's when that supraspinatus wants to kick in. So if it's uncomfortable, then you don't do it. Also getting them to relax their hand on you, if you can, or have their elbow on a ball, and slowly taking it forward and back, and doing gentle circles around, and allowing the shoulder to be heavy, not pressing it down, just to be heavy. Right, so I want you to lie on your back for me, please. Again, keeping the elbows in at the side, so we'll say it's that shoulder now. I'm going to allow her to just rest. You can just relax your knees like that. And then you can just relax. Okay, so here is great, and you've learned stuff in this position supine, and you've learned the hanging ones like that, and pulling it back, and all of those should be fine until you do those movements and those movements. And those are the ones that we're not going to be focusing on too much now. We want to get the movements that are close to the body, secure and stable. So in this position, you're going to inhale. Exhale, gently press the shoulders back onto the bed slightly, and then travel them down the bed for me. But nothing changes here. They'll want to arch their back, and we don't want that, okay? So we're going to inhale again. Exhale, pressing the shoulders back and traveling them down to the hips, and then release it. And exhale, pressing it back, traveling it down to the hips. So they get that feeling, and release it. Float your arms straight up in front of you. Inhale. I put my hands here. Exhale, pressing the shoulders down to the hips. So I want to feel more pressure on the shoulders than her on me. Okay, that's how I know it's working. So I want the work to be at the shoulders and not at the end range of her arm. So inhale. Exhale, pressing shoulders down. Yes, that's how I know I'm getting it, because she's light at the top here. I can push her arms up here and that stays down. And release. And exhale, pressing it, reach, hold, and release. And exhale, pressing it, reach, hold. Beautiful, excellent. And release. Bring your elbows in at your sides. There we go. She's going to keep that position there for me. Hold that. Turn your palms to face inwards. And I just want to grab her a circle. And again, I'm keeping her elbows close to her. She's not lifting her arms all over the place. We're placing that circle in between the hands there. Right, elbows are a couple of inches away from the waist. I want you to get that same position with her head. Inhale. Exhale, just gently pressing in with the hands, but the shoulders feel like they're bracing and holding on. Beautiful. And release. And exhale, pressing it in and hold. And release. And last one, chest is open, chin is in, hold. And release. Also looking at all of the exercises that you've learned in the protocol that your client does and they feel no pain and they're not feeling what they normally feel, those you can do and you add these in. What is contraindicated for it is, and we're always like, we need to stretch your pecs. So you're going to lie on your back with me on here. That impingement, doesn't matter how small it is, it could even be at the end phase of it and you're working with them in the final phase because that's what you're aiming for. Nowhere else, not when it just happens. This opening the arms out to the sides, it normally does not like. It also does not like the pec minor stretch, that position. So this is contraindicated for it. Don't do this until you've got everything set. You've done all of these other movements that are below that angle where it feels uncomfortable. You've got that range happening inwards here. You've done that one in the box where you're teaching them to draw down and get that connection. And this will be an indicator when they go into this type of position and they don't feel any of those symptoms anymore, that you're definitely on the right track. But these exercises are not great, these stretches. What you can do here, and what I love, is arms straight up. Allow them to drop the shoulder blades onto the foam roller and then gently reach it up, hold, and allow them to drop it onto the foam roller and reach it up. If that position still feels a bit uncomfortable, you lower the angle. You drop the shoulders on and you reach it up. And you drop it on, and you'll see she wants to flex thoracic spine. And you reach it up. Fantastic. You're going to turn the palms to face down. Exhale, reach your arms as far as you can down onto the bed. Press your hands into the bed with straight elbows and press the shoulders back onto the foam roller, because we also need to bring our shoulder blades closer together sometimes. And then slowly control it back up just to that angle. And exhale, reaching it down and opening the shoulders. Good. But when she opens, she doesn't arch all of this. This is still holding on. So I'm getting a true activation in between those shoulder blades. And then slowly controlling it up. Last one. And exhale, pressing it down. And then I like to keep them there and just have them hold that. Lengthening the back of the neck for 10, 9, 8, 7, fully extended elbows, 5, 4, 3, 2, 1, and then float the arms back up. Also really nice, interlace the fingers, rest them over your tummy for me, please. Allow the elbows to hang down. And all you want them to do here is just that gentle release. And as they're doing that release, you can say, right, stop. Press the shoulder blades back and release it again, and floating the elbows again, and stop, pressing it back and release. There's a couple of small things there that you can do with all of the other things that you've learned. As you go through them, you'll see what's working and what's not working, but add this in, look at the movements that it does not like, which is normally that 30 degrees, up to about, they're all right, and they go, oh no, that feels terrible, and then they say, but when I'm here, I feel okay. So you want to get those shoulders to really work well, to learn to release in this range here, and then you're going to educate them on how to raise it to that range. But when you've stabilized it here and you've got the muscles working properly here, you're strengthening and you're allowing this to release. Think about what's creating the impingement. Thinking about that bursa that's irritated. Become the bursa and think to yourself, well, I also don't want anybody rubbing me the whole time when I'm inflamed and when I'm sore. Think about cutting yourself or burning yourself on the stove and somebody comes and rubs you like this on it the whole time. You're going to be like, stop. So you don't do the movements that are going to irritate it, which is that angle to over there, which is that 30 degrees in front of you. They feel okay in extension, so those are the ones you want to do. They feel okay here. So these are the ones you want to do because they're allowing that one to rest. I hope that makes sense. Take care.